minute. We're excited to get to touch base with you. We'll give it a few minutes after the hour so other folks can sign in.
Ooh, yummy popsicles for this hot summer day. First day of summer, starting about 3:20 this afternoon.
You're exactly right, Lisa. Yeah, I wanted to channel the summer vibes for this call. I'm taking my nephew to the pool this afternoon, so I was really feeling the water.
Cool.
Yeah. I'll give it maybe 2 more minutes, then we'll dive in. And that pool pun was intended. All right, everyone, we will go ahead and get started. Thank you again for joining us. I know we got this one scheduled a bit late in the month, so we appreciate your quick responses to the doodle poll and making time to join us today. Dr. Bard unfortunately cannot join us. He is on a trip. He had a couple conferences back to back, one leading him to DC and the next to Switzerland. But he sends his regards, and he will be back with our collaborative at the next monthly call. So you're stuck with me today and Dr. Deshay. As usual, just a housekeeping reminder, we do record attendance. Lovely Lisa Tunley handles that for us so nicely. So if you could, if your name is not showing up on your Zoom window correctly, please change it so that we know who you are. If you need to change it, the instructions to do so are here. I know that's also hard to do if you've joined by phone, but if you can take a moment and make that change, we appreciate it. . clicked through and it looks like we got all our names. And thank you, Sarah, for your note. Others, if you were joined as a group and you want to have everyone's attendance recorded, feel free to throw that in the chat. All right. The agenda was sent out just a couple of hours ago. If you've had a packed day, you might not have had a chance to review it. We don't have too much to go over with you all, but there are a couple of announcements we wanted to make, and then to touch base again on this concept of social determinants of health that we discussed at the end of our last learning session. One of our announcements is that you will have a new liaison to contact at the Parent-Child Assistance Program, a new partner liaison. LaShonda will still be teaming with them for support, but Katie Fortune-Reagan, unfortunately, is transitioning to a new agency. We're grateful for the time that she dedicated to this project. But we want you to know who your next point of contact is, especially as the majority of you are focusing on PCAP for your PDSA. So if you have questions about PCAP, about a referral you tried to send, if you should send a referral, anything that's going to support you in using Unite Us and PCAP, your points of contact are going to be Erin Mayer and Angela Harnden. You've got opportunities to meet Erin. She spoke a bit at our last learning session, and I believe Angela has attended before.
And we also have one or both of them attending rounding calls this month.
Perfect. Yeah. Excellent. And they are the leadership of PCAP and will be wonderful resources. We ask if you do have questions about a referral to PCAP, please kind of use the Unite Us messaging feature as your frontline approach. But if that's not working, or if you have a more involved question that you want to touch base via email, you can check in with either myself or Lisa and we'll connect you, or you can email them at pcap@ou.edu. That inbox is monitored by Angela and she will see those. But just as a reminder, please don't send any PHI, like the name of your referral, and an email. You can only send PHI through the Unite Us message feature. And then I'll pause here because I know Erin was able to join us today. Erin, anything you want to add or say before we move on?
No, thank you for that. Yep, PCAP will go directly to Angela. I tried to keep the email contact as simple as possible so you could remember it and have it on hand. But you're also welcome to reach out to us directly if you have our email, which mine is just erin.mayer@ou.edu. So no, nothing more to say. Thank you.
Of course, yeah. Thanks for joining us. Thank you all for being mindful of this. I know we've really leaned on the liaisons to help us in this process. So we're very pleased that Erin and Angela will take up the mantle in Katie's absence. Another quick announcement, actually somebody in our learning collaborative suggested this resource, an agency called Illuminate Colorado. This is a site that conducts trainings for Head Start programs, as well as any program that provides some form of childcare personnel. That's a pretty loose definition, and so home visiting can fall underneath that. While they're focused on state initiatives within Colorado, they do have federal funding for a training that they call the Conversation Guide. And this is a guide that they created that overviews how to talk to families about substance use, how to explore stigma and biases families might experience due to substance use, how to screen substance use, and what methods might you use to do so. They also talk about resources and referrals that might be more closely related to either national resources or within the state of Colorado. But we wanted to make you all aware of it. We so enjoyed the breakout sessions that we did at our last learning session, and we hope you found it useful. If through that exercise or in your current focus on PCAP, you have found that some of your staff might benefit from additional training, this is available at no cost and it's virtual. So those are some great aspects to consider. Downside is that it is 4 hours and it's not on your own pace. There are scheduled times, but they do have lots of options that they're always updating. So currently on the website linked here that you'll get via email at the conclusion of our call, there are 6 upcoming trainings between now and our final learning session. So we just wanted you to be aware this is a resource. If anyone in your agency does the training, you receive their conversation guide booklet that goes over all these nuances of how to have these conversations. They also will send you some locking and safe storage bags that you could give out to your families. And they offer ongoing consultation. You're not required to attend those. It's not that you're signing up for more work, but it's just a resource of a team that's developed expertise on this topic that you could reach out to.
And if I could jump in, Tabitha, I'm looking at this website and they have the conversation guide for professionals on substance use, children and family training. And there's one offered on a week from today. There's another one on July 9th. There's another one on July 25th, another one on August 13th. And so they're spread out throughout the summer. And well, into through September, really. So I don't know about, I was looking to see if they had continuing education credit available, because I know some people need CEs for their licensure, but I don't see that information. I think we heard about this from Ariana, maybe. And does anybody happen to know if this organization offers CEs?
Yeah, it was me and Caroline. I don't know if they
She froze up there, Ariana.
While we wait to get Ariana back, if that would be useful for folks to know, I can also email my contact who I've been speaking to at Illuminate Colorado to get the specifics on that. This again is completely optional. We just want you to know this resource exists. We are asking them if they might come and do a 1-hour training as one of our monthly calls. So we'll see if they can come and do so. I'm not sure, but if not, just know that this exists. If you check their website, they have a lot of other super cool trainings. Unfortunately, those are just within the state of Colorado. This is the only one that they offer out of the state.
And I assume they won't share the booklet unless you go through the
Yeah.
training. Okay.
Yeah. So you get the guide after the training. All right. Another project announcement, just want to share where we're at with the referrals. And I saw that Kayla was able to join us. So Kayla, please chime in, add, or correct me if needed. This is showing all outgoing referrals for our collaborative. So this does include if you've made referrals outside of our 3 referral partners. But just to give you a snapshot of what was existing as of like 9 a.m. today. There have been 189 referrals sent out from this collaborative, which has impacted or represented 159 clients, which we're so thrilled about. You can see kind of the top senders up here. Some of your larger organizations, y'all are crushing it. And then top receiving, absolutely makes sense that Lasso is up there first, followed by Sooner Start. And we're excited to see PCAP grow now that we're focused on them. You can also see at the bottom of this visual, this referral volume. And I just want to point out here that we are seeing fewer of those recalled referrals. So thank you all for being mindful of following the guidelines we've sent out and being careful to make sure you send the correct organization. We're excited to see that drop in recalls. And we saw a nice bump in growth in May, a little lower here in June, but the month's not over yet. Oh, thank you very much, Erin, for sharing about this. Okay. All right. Kayla, anything you'd add about our overall data before I transition?
Thanks, Tabitha. I was just typing a note in the chat, but no, nothing to add. Just want to reiterate again that, excuse me, if you have new staff members, or if you just feel like you would benefit from a refresher training, then reach out to me and let me know. I know there's been a couple of organizations who've reached out. for example, because they had some questions about the referral process. It's been a while, and that's okay. I would rather walk you through it and have 5 or 10 minutes and give you back 15 than for you to feel like you don't know exactly where you're headed. So just want to reiterate that if you have new staff members, send them to me. And if you need a refresher training, then please feel free to reach out to me as well.
Thank you, Kayla. That is so helpful. We have benefited greatly from your ongoing training. Yeah, utilize Kayla as a resource if you want to check in on absolutely anything, especially now that we're in the home stretch. And you can refer to any of our 3 partners, which is so exciting. But we want you to feel supported in that. And I know this month in the rounding calls, you've been focusing on data with Lisa. And so if you found, gosh, we were missing some ETO forms, or we didn't think to check the custom form, or we didn't get it in Unite Us, but we got it in ETO, please utilize Kayla to help you refresh and get that data running back to tip top. Anything you want to add, Lisa?
No, thank you. I think you
All right.
got it.
Perfect. Okay. That concludes our project announcements for now. I want to talk a little bit about social determinants of health again. As specifically, we want to share back with you all the results from that kind of informal quiz we did at the learning session. And please keep in mind, while we're sharing these results, the goal was not for everyone to have 100% correct answers. I didn't know everything as we put those together. We're all learning together. The hope is that we can see where maybe we as a team of a collaborative might have areas where we could learn more, or maybe there's something about social determinants of health we're interested in and that's related to the work we're doing now, since the kind of main focus or through line of the Unite Us project really is to address those kind of care inequities. So those areas where families are experiencing social determinants of health, and we're trying to connect them to our really effective community referral partners so that that can be addressed. So as a reminder, we collected this data at our 2 learning sessions, and 64 of the folks from our Learning Collaborative participated. Throughout the next few slides, we're just going to go question by question, and to orient you, the green bars indicate correct answers. If anyone is colorblind, can't see green, I will say aloud which one was correct as well. All right, so our first question was just about the definition of social determinants of health, and understanding one way to define that is that these are non-medical factors that affect health outcomes. So that seemed to be something we were generally on the same page about. Next, we wanted to think about which of the following types of influences are related to common social determinants of health that affect the families we serve. So there were a few of these. The correct answers are where you live in your neighborhood, where you're born, where you work, your genetics, and your age. And as you can see here, everyone knew where you live and your neighborhood was a social determinant of health. And we saw a few differences, especially with regard to age, understanding that age can also impact your health experience. Everyone got this one, that experiencing inequities and social determinants of health is related to a higher frequency of depression and anxiety. And most folks got that compared to people who have low debt, people with greater debt are more likely to experience a mental health disorder, even after equating these groups on income and other sociodemographic variables that might have been used to explain health differences in mental health. Again, most folks also were on the same page that having experienced a health inequity can make someone less likely to receive services. That is true. Most folks also got that cities that have a better park score, which is represented by a few different aspects, but including how much acreage is at the park, how easily it is to access the park, and how much the actual park structures are accessible, and different amenities that might be featured at a park, tend to have better ratings of community mental and physical health, even after accounting for other potential variables. Similarly, most folks got this, so we know a lot about social determinants of health, but that they've been found to have a greater influence on health than even genetics or access to healthcare services. Some of these really specific statistics I couldn't pull out of a hat, so this is where we might see some differences, but wanting to highlight the experience in Oklahoma. So we talked about how 45% of renters in Oklahoma are cost burdened, where cost burden means a person spends more than 30% of their income on housing needs. Next was about quality education and how that's related to a healthier life. And the question was about where Oklahoma ranks among other states when we think about quality childhood education, where a higher rank means better education quality. Folks got that we're in the bottom 10 worst, which is true. I think we're second worst, if I remember, 48. Again, focusing here at home, where does Oklahoma rank for rates of adult substance use? Where a higher ranking means a higher rate of adults experiencing substance use disorders. And we are in the top 10. We're also number 2 here. Next, asking which of the following are experienced by folks who don't have access to grocery stores that offer healthy foods in comparison to people who can access them pretty easily. And this was across the board. Most folks got it. It's kind of all of these, that there's a higher risk of heart disease, diabetes, and lower life expectancy. Next topic we talked about was that healthcare patients with past and current legal problems might experience more frequent utilization of emergency services, greater difficulty accessing needed services, and higher costs when those are accessed. Another area where we saw a little bit of differences in our answers was about aspects of a job, and which aspects are least likely to affect a worker's health, or in other words, to be a social determinant of health. So the answer here was the number of coworkers, and that's not generally considered a social determinant of health or to have a large impact on health, but the others do. So access to benefits, safety, and pay. I know we went over those answers at the last learning session toward the end, but I wanted you all to have an opportunity to see how folks responded. And I want to pass the mic over to Lisa to guide us through a discussion and a short survey about this.
So what do y'all think? Did you notice any patterns? What surprised you? What didn't you know? Everybody must be taking their afternoon nap. We've brought you in here right after lunch. Your stomach's full. You're getting sleepy.
I wonder on this, Lisa, and because one of the things that's very harmful to Black and Brown people, families and youth and everything is the racism is huge. And so in thinking about this group and what we do, being able to, address some of those things, make sure we're providing culturally competent services, evaluating ourselves as service providers, and having a very diverse group of providers here. So, just thinking along that line and thinking of social determinants of health and what our families are encountering, is there something we could do? Are we in a great position to maybe address or challenge our programs to, dig deep in these areas? Just don't have an answer, just something that's twirling around in my head. We talked about education is part of it. And then when you get into medical care and all that health care, the racism and stuff is so hard on the minorities. And so thinking about that.
Yeah, absolutely. And lots of times when we talk about racism and differences in racial groups, what we're talking about is how that is embedded in our society and related to all these social determinants of health. Lots of times when we say there's a difference between this group and that group, it's because of the social determinants of health and how there have been systemic differences in people's access to health care and the kinds of neighborhoods they've been allowed to live in and or been forced to live in, and ongoing racism that can affect their ability to find culturally appropriate health care.
I think that,
yeah, go
oh,
ahead.
I'm sorry.
No, I was going to say, what do the rest of y'all think? So go ahead, Blar.
I think that many times because this vulnerable population is so beaten down with so highly burdened, whenever they do manage to get their foot in the door with us, that we should remove any type of barrier that is needed to make that a successful contact. Because I've seen many people that reach out to services and either they can't get a hold of the right person, or they're given the runaround, or they're asked to do something that they're literally not able to do because they're not in the right frame of mind. Like, fill out this, 10-page question or, survey or questionnaire or whatever to complete the application. If you don't do that application, you can't be seen. Those sort of things that produce a bigger burden, and we're kind of shutting the door on them when they've already made the effort to even get in there. So I'm all for removing any of those things and make that contact. If they've made that effort to reach out to us, let's make it count and make sure that we are able to help them.
A real good point. And increasingly, language barriers are associated with the problems with getting such forms filled out, and knowledge about where to access records, like sometimes if they're asked for a birth certificate, and the ability to get that can be affected. LaShonda, I see your question. So what's the impact on y'all? How is it affecting your work? And how is it affecting you?
I just wanted to make another comment on necessarily on that, but that we can continue this conversation, because maybe what called my attention that we're in this field and we didn't get 100% on everything. So obviously we still have to continue a conversation, education among us in order to be able to transmit it to our staff and staff probably working in a different way with families.
I think that's a good segue into this questionnaire that we'd like for you to complete. I'm going to drop it in the chat if it's all right with Tabitha. Timing's good. Okay. This is just one question, and educating ourselves is what this question is about, and what can we do to help with that. So if everyone would please go to this one question survey and complete it. We'll just pause here for just a minute. And anybody who wants to say anything else continuing on this topic, go ahead and chime in now.
I was going to say an observation. I see more neighborhoods now with sidewalks. So I think, and I believe, I mean, I'm not too much involved with any homeowners association. Probably the president would like a few of us to do some more, but I believe, when you have a certain amount of housing, you need to have a park or something, kind of for entertain for the children. And I think it's an effort to, you know, have a play area, because I mean, some families, then maybe they don't have a yard, you know, that also a safe place for the child to play. And yeah, even if we encourage families, well, you know, especially when the weather is good, just take your babies to walk. I mean, if you are not in a safe neighborhood and not walkable, I mean, you just cannot do that. So, but again, you know, I see even between, you know, short distance, more, you know, space for to promote walking. That's one of the things that I mean, coming from another country, I mean, we walk a lot. And in here I was like, well, I miss, you know, those especially when you can walk to places. So
That's an excellent point, Yolanda. Thank you for sharing that. And to that point, you all might be aware of social determinants of health affecting your families that we've not highlighted or discussed. So we really will review your responses to that survey question. We've got the July monthly call and the August monthly call and September earning session upcoming. Not that this conversation ever goes away, but since we're focusing on it now, we'd love to utilize those touch points with you to just continue to elevate this discussion. So we really value what you think is important, what would be useful to bring in and discuss. So thank you for taking your time on that.
Okay, there might have been somebody who popped in late. If you could complete this one question survey, just to give us some ideas of some things that we might want to talk about related to social determinants of health.
Thank you, Lisa. Okay. We'd like to hear from you just a little bit more. It's been a month since we met for our learning session, where we did our breakout groups and focused on different scenarios on how a family might respond when you're screening them for substance use and trying to make a referral to services. We were curious if you all could share back with us how those conversations are going now that you're meeting with families, you're screening them for substance use concerns. We'd love to hear any insights you have, any tips from the trenches you could share with the other supervisors on the call to support their staff. And then what, if anything, has made the process of screening so we could make referrals to PCAP easier.
So how many of y'all have done some screening? Raise your hand. You can do that with your reactions. Kristen has not yet. Cynthia says that they've done one.
I was going to say the OCCHD C1 team, we haven't yet, but on Monday, our next Monday meeting, we're planning to go over everything with our nurses and start next week. So hopefully then we'll have more to report back about.
Okay, great, Sarah. Thank you. Cynthia, did your screening go all right? She may not have access to a microphone. What can we do to support you? Thank you, Dwan. Do you need more resources? Is there anything that would make the process easier or make you feel more prepared for these conversations?
And, you know, we have the Parent Partnership Advisory Committee, which are made up of families that have utilized one of these services. And so I wonder if, you know, if you guys have questions or you'd like to maybe talk to families or something, you know, now I'm not sure if they have, you know, history of using substances, but still, parents, what is it like to be asked these things, and what words, it's just changing vocabulary and different things. But if something like that will be helpful for you guys. If you think of something like that, outside of this meeting, you guys all have my contact information, but the PAC is assigned to this group to help make things family friendly.
Thank you, LaShonda. Good
That's a
reminder.
great suggestion. And PCAP also has a parent advisory committee of parents who have struggled with substance use. So we could also utilize them if it'd be helpful to have them come talk, or if somebody wants to individually reach out to them, we could pay for their time to provide that consultation for you all.
Thank you, Erin.
Cynthia, thank you for your note. So emphasizing that knowing the family well, having a relationship established can really help these conversations, and using some of those strong motivational interviewing techniques. If you haven't learned those before, we're happy to share resources about that, but it's very helpful in having conversations about substance use and other behaviors to change.
For the we do have a couple, a mom and a dad, that are active in the PPAC that are monolingual Spanish speaking. My memory's failing me now what country they immigrated from, but they are so passionate about providing parent voice and things like that. So if cultures and things are different, I know there's great variety in Latinx communities, but that may be something. If you think that would be more helpful, talking to someone that may identify with your culture or something. So.
Thank you, LaShonda and Erin, for offering those resources, especially because that was not emphasized here. While we are happy to connect you all day as much as we can, there's no better resource than the parent voice themselves. So I'm glad to know those are available. So again, we have the PCAP and PPAC, just anagrams of one another. But anyway, we can contact these parents and they will support you. Any other resources related to screening substance use or otherwise, as we are focusing on Sooner Start, PCAP, and LASSO, utilizing Unite Us through the next couple months of this specific collaborative focus? Or have we done so well, you've got everything you need? All right. Well, if you think of something else, bring it up in your rounding calls. Go ahead.
Yeah, so because some of the agencies are still getting their staff aware of the PDSAs, and so once you get into it, then you may get some ideas for some needs that we might be able to help fill.
Yeah. So please let us know. All right. Well, we thank you for coming and chatting with us on these topics. We'll see you again soon. We won't hold you longer than needed, but just a couple quick reminders. And we will have your July rounding calls per usual, as well as a July monthly call. We will try to use the feedback you gave on the survey you completed this call to help us inform what we will discuss and bring back to you. Again, if you reach out between now and then with any other resources that would help with this particular focus, we will do so. Also, just want to re-plug that we are planning for our final learning session of this project to be in person. We're so excited to see you face to face and just share a room together. We are planning that for September 2024. Please complete the doodle poll that Lisa sent out. It looks like the options are the 23rd and the 30th, and the 30th is definitely winning, but complete it if you haven't. We would love to see you. That more details will be forthcoming, but the plan right now is that we will host it in Oklahoma City for this time. Also would be next time we do it in person. And we are excited to finalize this project.
Thank you, everybody, for your time. Y'all have a good afternoon.
Thanks all.
Bye-bye.
And Lisa, you've got access to those slides to send out.
Yes, can you hear me?
Yes.
Oh my gosh, everything is frozen. I can't even close the meeting. It's so weird.
Oh no.
I don't know what happened. Everything is frozen, but you can hear me. I don't know.
I can hear you. It might just be, yeah, frozen for a moment. It's still recording, so whenever it comes on, you should be able to shut it off.
Okay. All right.
Great.
Yeah, I wanted to say something, but I couldn't get my mouse over, but I guess I pushed the right keys to unmute it from the keyboard. And so I guess that's how I became unmuted. But I wanted to
Oh,
say
that's so
something to
funny.
everybody to beg them to please vote today so that I can get everything squared away with the parking reservations and booking the room. But I think it'll be in Nicholson on the 5th floor. That seems like the best spot.
Yeah. Yeah, I agree. Okay. Well, hopefully that reminder will help in sending out the PowerPoint. But it does look like the 30th is winning by quite a margin, so we might just have to decide.
Okay. That's fine with me. I know,
thanks,
I
Lisa.
think C1 Tulsa said they said it was a recurring meeting that they religiously go to. I'm like, you can't skip one time or in-person meeting.
Oh gosh.
So
That's good to know. Let me know if that you said it, double check and send me an email about that, and I'll check with David about what he wants to do.
okay. All right, I'm gonna try to get this fixed. Hopefully I'll be able to close it. I don't know what's going on.
Okay, good luck.
Thanks.
Bye.
Bye. What the heck is happening? This is not working.